Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
And of the duo just introduced, I'm Jim Stallings, and the other one is Kay Murray. Good morning, Kay.
Good morning, James.
And today's Health Talk program is going to be about gynecologic conditions and also Mon General's new orthopedic center hosting community open house. Let's see, that was yesterday. All right, thanks, Greg, for that information. We won't talk about that today. With us today is Dr. McBee, and he is an oncologist on staff at Mon General Hospital. Good morning and welcome to the program.
Good morning. Thank you.
And welcome back. And we're going to talk about screening for gynecologic conditions to start off the show today. So what are the appropriate screenings for different stages of life?
So the most important thing is that women see their gynecologist yearly. There are certain things that go along with the screening, such as Pap tests, pelvic exams, and those change based on the year and the stage of life. But the most important thing is that a woman sees her gynecologist at least yearly.
And I would like to kind of focus in on the part of ovarian cancer because I have a loved one that lost their life with ovarian cancer. And it's almost like a silent killer. And you may go and you may get your yearly checkups, but sometimes, Dr. McBee, this is just not caught in a regular exam.
No, that's exactly right. You know, the recommended screening for most women is to have a bimanual examination every year, but even with bimanual examinations yearly, we still miss a lot of ovarian cancer. Even in the best hands and women who are thin and are easier to examine, we still miss a lot of pelvic masses. We don't have a great screening test for ovarian cancer. There's a lot of companies trying to come out with a blood test or a combination of blood test and ultrasound that will help screen for ovarian cancer. The best we really have right now are ultrasounds, pelvic ultrasounds, as well as a CA-125, and even that's not very good when you combine those two modalities in women who are at high risk and women who have a genetic mutation that predisposes them to have an increased risk of breast cancer. Even those two modalities alone really miss a lot of ovarian cancer.
So it's not automatic that we're going to have the ultrasound. It's not automatic that we're going to have the blood test. So it's almost like something ready to blow up in our body because we go every year. We try to do the right things. We have the Pap smears, but this is something that can escape a doctor.
Yeah, and the best thing we have right now is to talk to your gynecologist, find out if you are at an increased risk, if you have a family history of breast cancer, ovarian cancer, or other conditions that may predispose you to having a genetic mutation that would put you at increased risk of ovarian cancer. If not, the recommendation would be yearly bimanual examinations. If you do have an increased risk, then a lot of times we do CA-125s in postmenopausal women as well as pelvic ultrasounds.
So the ovarian cancer is difficult to detect?
It's difficult to detect because number one, the blood test most people have heard of a CA-125. However, in premenopausal women and women who are still menstruating, there's a lot of conditions that can falsely elevate the CA, or not falsely elevate, but they can elevate the CA-125. It can also be normal in a lot of women with early stage ovarian cancer. So normal CA-125 is not that reassuring, and an elevated CA-125 does not necessarily mean you have ovarian cancer. So it's not a very good blood test for screen. Actually, it's a horrible blood test to screen for ovarian cancer. Also, a lot of times the cancers start out very small. They start out as a single cell. So, at what point can you detect a cancer, and what point and the goal was to detect a cancer before it spreads outside of the ovary and becomes a lot more difficult to manage. Our ability to cure ovarian cancer is very, very high if we can catch it while it's still within one or both ovaries. Our ability to cure ovarian cancer is horrible once it's spread outside of the ovary.
So can you get a biopsy to determine?
Biopsies are actually contraindicated for ovarian cancer because if there is a cancer confined within the ovary, you don't want to spread it. So if you have enough worry about an ovary, either based on ultrasound or exam or CA-125 if you get it, and based on other patient characteristics, the age, a lot of other stuff, then if you're worried about it, you should remove the ovary intact and that's how we biopsy it. We don't really biopsy ovaries.
Would a woman have more cysts or more bleeding or more signs if it's going to lead into ovarian cancer?
You know, in a lot of times the signs are retrospective signs. So a lot of times women who are eventually diagnosed with ovarian cancer will look back and say, you know, for the last 3 to 4 months, I've noted they're full quicker when they eat. They have a little bit of nausea. They have a little bit of pelvic pressure, maybe some changes in urination or stool. And that's really the most important thing that women can kind of alert their physicians if they notice that they just feel differently. If they feel like, you know, again, they're going to the bathroom more frequently, or they have more pelvic pressure, or again, nausea. Early satiety, those are things that they should alert their physician, because a lot of times there are some subtle findings that, again, most women who are diagnosed with ovarian cancer will look back and say, you know, I did notice that now that you say that. Mm-hmm. So that's really the most important thing women can do if they feel changes in their body that are just different.
Yeah, don't ignore it.
Don't ignore it, that's right.
And you mentioned a cell, it starts as a cell, mm-hmm. but these masses can grow very quickly if it's going to be leading you into ovarian cancer.
I mean, the way we explain tumor growth is by doubling of the cells, and each different type of tumor have a different cell doubling time. But if you think about the time, you know, to go from 1 cell to, say, an inch in size, it doesn't take very long to go from 1 inch to, you know, to 2 inches to 4 inches to 8 inches, and that's a huge. Even though it seems like it's growing rapidly, it actually took quite a long time to get from 1 cell to 1 inch. A lot more time than, for example, it would take to go from 1 inch to 12 inches.
And again, you may not know it. You just may not be aware of it. I think what signs I had seen from the one that I know went through this, they became very tired and couldn't understand why they were so tired, just couldn't seem to get their motor running every day. And that kind of led them down the road. I need to find something to help me through this.
Yeah, and I think and I really think that's a take-home message. Again, if there's changes in your body that just are different, you should talk to your primary care doctor, talk to your gynecologist.
304-296-0041 is our number for you to ask a question or make a comment with Dr. William McBee this morning. Again, 304-296-0041. We'll be back right after this.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
By the way, the Mon General Orthopedic Center, the new center, opened last night with an open house and will be open for patients on Monday morning. The new orthopedic center features 4 state-of-the-art operating rooms, 13 private pre- and post-operation rooms, and an 8-bed post-anesthesia recovery unit. And so congratulations to Mon General for that opening. With us today is Dr. William McBee. Says we can call him Billy, so we will. Dr. Billy on the program, ready to take your phone calls at 304-296-0041.
Let's talk about the age factor surrounding ovarian cancer, something that I seem to worry a lot about these days. So the age factor of getting ovarian cancer, is that going to come later in life?
Yeah, the most common type of ovarian cancer is what's called epithelial ovarian cancer, which is actually cancer of the lining of the ovary. And the most common age for women to develop epithelial ovarian cancer is women in their late 50s, early to mid 60s. Now, certainly I have many patients that are in their 40s. It's fairly rare in women in their 30s, but certainly also women in their 70s, 80s can develop this type of cancer. Now, there are other types of ovarian cancer that are actually, one type is called germ cell tumors, and the other type is called sex cord stromal tumors, but essentially they're tumors that actually arise from within the ovary. And those are more common in women who are in their teens, 20s, and 30s, and become fairly rare after that.
So if you diagnose it's ovarian cancer, where do you begin? Where does the process begin?
The process almost always begins with surgical removal, and depending on the patient's age, whether they desire to maintain fertility or not, you at the very least remove one ovary, and almost all ovarian cancers too will stage the patient, means we'll remove lymph nodes in the omentum, which is a fatty apron that hangs from the transverse colon, and take some peritoneal biopsies to be sure that the cancer hasn't spread. For early stage disease, this certainly can be done laparoscopically. For patients who have disease that is already spread outside the ovary, it should be done with an open incision. In patients who have completed childbearing, we also remove the other ovary as well as the uterus.
So if we're predisposed, what can we do to make sure this does not happen to us later on in life?
So if you talk to your doctor and you think that you have an increased risk of possibly having a genetic mutation, you should be referred to a genetics counselor. You should sit down with a genetics counselor, and they really spend a lot of time to go through your entire family tree to really decide if you do have an increased risk of certain types of genetic syndromes. And if you're found, and then based on the genetics counseling session, then they may refer you for a blood test to see if you have this genetic mutation. And if you do, then certainly the recommendations change based on your age, again, fertility desires, as far as for GYN things to be as far as removing the uterus, the ovaries, so on and so forth.
You just touched on the types, but can you get more specific about the different types of ovarian cancer?
Again, we kind of break ovarian cancer down into epithelial ovarian cancer, germ cell tumors, and sex cord stromal tumors. And then within those different main classifications, we have different histologic types, such as clear cell cancers, papillary serous cancers, mucinous cancers. But really, for most people, that ovarian cancer is ovarian cancer. Most people probably don't know anybody with a germ cell tumor or a sex cord stromal tumor. Most ovarian cancer is the epithelial ovarian cancer.
Do you have any numbers on how you can survive ovarian cancer? I mean, once you find you have ovarian cancer, what are our possibilities to survive normally?
The most important thing for ovarian cancer as far as survival goes is being able to diagnose the cancer at an early stage. And unfortunately, we don't have a great screening test. But so the survival numbers really mirror the stage of the cancer. If we can diagnose patients with stage 1 or stage 2 ovarian cancer, we treat it with surgery and almost always followed by chemotherapy. Patients with advanced stage ovarian cancer, we still sometimes can cure them of ovarian cancer, but it's a lot less likely than if they have stage 1 or stage 2 cancer.
I want to ask you about cervical cancer. Is it similar?
No, it's different. I mean, we do have a good screening test for cervical cancer. So the screening test for cervical cancer is a pap smear. Almost all cervical cancer comes from a virus, from human papilloma virus. It's a virus that most people have been exposed to. About 80 to 85% of people at some point in their life have been exposed to the HPV virus. And certainly in younger people in their late teens, 20s, about 50% of people at any given time have an active HPV infection. So it's an extremely common virus. Most everybody's been exposed to it. We do have a good screening test for cervical cancer. The guidelines for cervical cancer screening change. And certainly it's one of the things that you should talk to your gynecologist about, and they'll decide when you need to be screened for cervical cancer, when you need a pap smear. I'm sorry.
Is this virus transmitted sexually?
It is, but it doesn't have to be sexual intercourse. Really, any sexual contact can spread the virus.
Because that was a controversy about the vaccination of getting young girls 9 and 10 years of age vaccinated for this. Their moms were saying, and dads too, were thinking that's a green light to go ahead and have sex at a young age.
Yeah, I mean, they've looked at this time and time again, and they've really shown that that's not true. I mean, the same thing if you have, access to condoms, it doesn't necessarily promote sexual activity. The same thing is certainly true for the virus. There's many reasons to give it at the young age. You want to give it before there's any sexual contact at all, while the patients are still naive and not been exposed to the virus. So it's important to give it early. And the second thing is the immune process in somebody, 10, 11, 12, 13 is different than somebody in their late teens. So you actually have a better immune response by giving the vaccine early, and you'll have better resistance to the virus later on.
How long will the vaccine be effective?
We don't know right now. Right now, the initial studies are about 10 to 12 years out, and it's not. The vaccine does not require a titer or another vaccine dose yet. So we know it's at least good for 10 or 12 years. It's only been FDA approved for about 5 or 6. So certainly, anybody who's gotten the vaccine is protected. And the study population again is about 5 or 6 years ahead of the FDA approved people that have received it. So. It's good indefinitely for now. At some point we may find that it requires a titer or a second vaccine administration, but not yet.
If you could, or if you were a administrator with the CDC, would you like to see all young girls vaccinated?
I'd like to see all young girls and all young boys vaccinated. It's also FDA approved for boys. So there's 2 different vaccines. There's a Merck vaccine called Gardasil, and there's a GSK vaccine called Cervarix. The GSK vaccine is not FDA approved for boys, but the Merck vaccine is. So I think all young boys and girls should be vaccinated.
So many people are exposed to the virus and contact the virus. Are there certain candidates or conditions that develops into cancer? The virus doesn't always develop into cancer, right?
That's right. Yeah, there's certain things. Certainly, if you have HIV or any other like immunosuppressive disorders, you could have an increased risk of. But it's really we don't have. There's certain risk factors that do go along to people that develop severe cervical dysplasia or cervical cancer, but not always. Certainly, you can see. You don't want to kind of lump patients into groups. Essentially, anybody who's been exposed to HPV can develop cervical cancer.
So Pap smears can determine cervical cancer. Any blood tests or anything that determine?
Well, we do HPV testing again on from DNA-based testing from the cervix, but no blood tests. You can do blood tests to see if patients been exposed to HPV, but really the most important thing is a Pap smear and HPV testing from the cervix if indicated.
And can you remove cancerous cells from the cervix to treat it?
You can. You can either remove part of the cervix or you can remove all the cervix with a hysterectomy if needed.
Our number is 304-296-0041. You are listening to Health Talk, brought to you by Mon General Hospital on WAJR.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
This is Health Talk, brought to you by Mon General every Thursday morning, 8:35 here on WAJR. Dr. William McBee, OB/GYN oncologist on staff at Mon General Hospital, is our guest.
Yeah, and I'm sure there's a lot of research that continues with ovarian cancer, trying to find ways to detect it, as we've talked about in the beginning. What about showing why some women will have these masses and other women will not? Has there been anything to show why through lifestyle or anything of what we're eating?
Yeah, there's not been a lot of stuff on lifestyle for ovarian cancer. Certainly there are women that are at increased risk because of genetic mutations, but we've not been able to show a lot of lifestyle, things that have put women at increased risk of ovarian cancer. Now, we certainly have shown that for cervical cancer to some extent, and certainly endometrial cancer, women who are obese and have other medical problems associated with obesity have a higher risk of endometrial cancer, but we've not really shown that direct benefit with ovarian cancer.
But always good to live that good lifestyle with good food, wholesome food, exercise.
Absolutely.
That's going to help no matter what we do. But if we see that our mother has had ovarian cancer, maybe our grandmother, what should one do to protect themselves?
I think the most important thing, again, is to talk to your gynecologist and have them review a family history, find out. There may be things, too, that aren't quite obvious to most patients, such as family histories of pancreatic cancer or colon cancer, some other things that certainly can increase your risk of genetic syndromes.
And don't feel because this is not detected immediately that you shouldn't go get those yearly checkups. That is still the number one issue. Early detection can save your life.
That's right.
So get those yearly checkups and let your doctor know about family history, and get to know your doctor too, so you can talk to them in those ways.
And like we talked about before, look for symptoms, things that are different for you.
Now, you have your own office right above near Suncrest Town Center?
Well, right now I'm with High School King Burns and Tallman in Suncrest Town Center.
Okay, very good. And, of course, you're on staff with Mon General Hospital. That's why we have you on the program today. Thank you so much for coming back.
And because he's really good.
Yeah. All right.
You, guys.
Thank you, Dr. McBee. We appreciate it. A.K.A. Dr. Billy here on Health Talk on WAJR.